Hello, it's Dr. Rhonda Johnson. Today is Thursday, April 7th, 2022, and today I'm talking about the Africa COVID-19 paradox. Folks, aside from South Africa, we don't hear much about COVID-19 disease in the continent of Africa. Africa hasn't been spared from COVID, but the outcomes are very different. So that's why I'm addressing this today. But first, a quick review. Africa is the world's second largest continent in terms of population and landmass size. It's a continent that's home to 1.3 billion people, which accounts for 17% of the world's population. Now, according to Reuters, there have been at least 11.7 million COVID infections that are documented and 252,000 deaths from COVID. Now, I compare this to 80 million documented cases in the U.S. and 981,000 deaths in the U.S., and there's a big difference. Well, there was a recent article in New York Times addressing this paradox, and some key facts is that blood testing for antibodies has shown that COVID has spread widely. Data show that roughly 2/3 of the population in sub-Saharan Africa have antibodies to the SARS-CoV-2 virus, and only 14% of the population has received any type of COVID vaccine. Therefore, immunity is overwhelmingly from natural infection. So what are the explanations for the Africa COVID-19 paradox? Well, experts aren't sure, but perhaps it's the younger population, because nearly 2/3 of the population in sub-Saharan Africa is under 25, and only 3% is 65 or older. So it means that younger people are less likely to have these chronic conditions such as high blood pressure, diabetes, asthma, heart disease that we know increases the risk of dying from COVID. Also, young people are often asymptomatic with COVID. And it could also be the environmental factors. A lot of living is outdoors, and some of it's rural without mass public transportation. So again, better ventilation may be limiting the amount of viral load that people get infected with. Now, we recognize that some sub-Saharan nations have pressing health needs in terms of malaria, HIV, tuberculosis, and other tropical parasitic diseases. And some African public health experts say the priority in terms of public health intervention is for these diseases and not COVID-19 mass vaccination. In fact, when I was in Kenya in February 2020 at a rural hospital, the doctor said they were far more concerned about malaria, HIV, and TB than COVID. So many lessons to learn from Africa, and that's my message today. As always, my views are my own. Stay safe.